Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today, we're learning about physiological changes during pregnancy. So go ahead, subscribe, and let's get started. Now, let's understand what pregnancy means. Pregnancy is the period during which a baby develops inside a woman's uterus or womb. It begins after fertilization and continues until the baby is born. Usually pregnancy lasts about 40 weeks, which is a little more than 9 months. Doctors calculate this from the first day of the woman's last menstrual period until delivery. For example, if a woman's last period started in January, the expected delivery may be around October. During pregnancy, the baby grows and develops step by step inside the uterus until birth. Next, we will discuss the duration of pregnancy. A normal pregnancy usually lasts about 40 weeks, which is a little over 9 months. Pregnancy is divided into 3 stages called trimesters. The first trimester is from 0 to 12 weeks. During this stage, the baby starts developing, and the mother may experience symptoms like nausea, vomiting, and tiredness. The second trimester is from 13 to 28 weeks. This is often called the more comfortable stage because many early symptoms reduce, and the baby grows rapidly. The mother may also start feeling the baby move. The third trimester is from 29 to 40 weeks. In this stage, the baby continues to grow and prepare for birth. The mother may feel heavier and more tired as delivery gets closer. Now, let's discuss the first trimester, which is from 0 to 12 weeks. During this stage, the baby's body organs start developing. This process is called organogenesis. It is considered the most critical stage of pregnancy because the baby's major organs, like the heart, brain, and limbs, begin to form. During this time, harmful factors like infections, certain drugs, alcohol, smoking, or radiation can affect the baby's development. For example, smoking or alcohol use during early pregnancy can increase the risk of birth defects. That is why proper nutrition, regular checkups, and avoiding harmful substances are very important during the first trimester. Now, let's see what happens in the fetus during the first trimester. First, the fertilized egg attaches to the wall of the uterus. This is called implantation. Then, the placenta and umbilical cord begin to form. These help provide oxygen and nutrients to the growing baby. The baby's brain and spinal cord also start developing very early in pregnancy. Around the 6th week, the baby's heart starts beating. Slowly, body parts like the eyes, ears, arms, and legs begin to form. Major organs such as the liver, kidneys, and lungs also start developing during this stage. Even though the baby is still very small, many important changes happen in the first trimester. Now, let's discuss some common maternal symptoms during the first trimester of pregnancy. Many women experience morning sickness, which means nausea or vomiting, especially in the morning. Fatigue, or feeling very tired, is also common because the body is adjusting to pregnancy changes. Some women may notice breast tenderness, where the breast feels sore or sensitive. Frequent urination can also happen because hormonal changes and the growing uterus put pressure on the bladder. In simple words, during this stage, the baby's body structure and organs are being built, so many important changes are happening inside the mother's body too. Now, let's discuss the second trimester, which is from 13 to 28 weeks. During this stage, the organs that formed earlier continue to grow and start working properly. This is the period of rapid fetal growth and development. The baby becomes bigger, stronger, and more active. Many mothers start feeling the baby's movements during this trimester. Compared to the first trimester, most women feel more comfortable because symptoms like nausea and tiredness usually decrease. During the second trimester, the baby grows rapidly in size and weight. The bones become stronger, and features like hair, eyebrows, and nails begin to appear. The mother can start feeling the baby's movements, called quickening. The baby's hearing also develops, and the heartbeat can be heard clearly during checkups. By ultrasound, the baby's sex may also be identified during this stage. During the second trimester, the mother's abdomen becomes larger as the baby grows. Weight gain gradually increases, and many mothers start feeling more energetic and comfortable. Morning sickness usually decreases during this stage, making daily activities easier. Next, we will discuss the third trimester of pregnancy. During this stage, the baby grows very fast and gains more weight. The organs, especially the lungs and brain, continue to mature, so the baby can survive outside the mother's womb after birth. The baby also becomes more active, and movements can be felt clearly by the mother. This is the final stage of pregnancy, where both the mother and baby prepare for delivery. Now, let us see what happens to the baby during the third trimester. During this stage, the baby gains weight very quickly and fat is stored under the skin, making the baby look healthier and fuller. The lungs continue to mature so the baby can breathe after birth, and the brain develops rapidly. The baby usually moves into a head-down position in preparation for delivery, and reflexes become well developed. Now, let us discuss the changes that occur in the mother during the third trimester. As the baby grows bigger, many mothers experience backache because of the extra weight and pressure on the back muscles. Some mothers may also feel shortness of breath as the growing uterus presses upward against the lungs. Swelling of the feet and ankles is common due to fluid retention and increased body weight. Braxton Hicks contractions, also called practice contractions, may occur. These are usually irregular and help the body prepare for labor. Many mothers may also feel anxious or excited about labor and delivery as the due date gets closer. These changes are normal during the final stage of pregnancy. Now, let us discuss how the body prepares for labor and delivery. During the final weeks of pregnancy, the cervix slowly begins to soften and prepare for the baby's birth. The uterus also gets ready for labor contractions, which help push the baby out during delivery. At the same time, the mother prepares both physically and emotionally for childbirth. She may feel excited, nervous, or eager to meet the baby. In simple words, this stage means the baby is fully developed and getting ready to be born. To make it easy to remember the stages of pregnancy, use this simple memory trick: build, grow, ready. In the first trimester, the baby's organs are built. In the second trimester, the baby grows bigger and stronger. In the third trimester, the baby gets ready for birth and life outside the womb. That's the end of this video. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.